In this video, we will be continuing all the terms needed for Unit 5 of AP Psychology. Let's get started with therapy. Psychotherapy is when you're talking with a therapist to improve mental health. Evidence-based interventions are treatments that are proven to work. Therapeutic alliance is the trust between the client and the therapist. Biomedical therapist is a therapy way by using medicine. Psychotropic medication therapy are drugs that affect the brain and your behavior. Asylums are hospitals for the mentally ill. Deinstitutionalization is releasing patients from mental hospitals. Non-maleficence simply means do no harm. Fidelity is being trustworthy and loyal. Psychodynamic therapies is when you're uncovering unconscious conflicts. Free association is saying whatever comes to mind. Transference is projecting your feelings onto a therapist. Cognitive therapies or restructuring is changing negative thinking. Cognitive triad means negative views of self, world, or the future. Applied behavior analysis is using rewards to change behavior. Counter conditioning is pairing fear with relaxation. Biofeedback is controlling your body using feedback, such as watching your heart rate to stay calm. Exposure therapies is when you're facing fears gradually. Systematic desensitization is relaxation plus exposure to fear, such as breathing calmly while seeing a picture of a snake. Aversive conditioning is pairing bad habits with discomfort. For example, using vinegar as nail polish so you stop biting your nails. Token economy is rewards for good behavior. Cognitive behavioral therapy is when it helps people to change their harmful thoughts and behavior. Dialectical behavior therapy is basically CBT plus learning how to control emotions. Rational emotive behavioral therapy is challenging beliefs to improve well-being. For example, when someone replaces "everyone must like me" with "I'm okay if they don't." Humanistic approach to therapy is a therapist mainly focusing on clients' personal growth. Insight therapies is when you're gaining deep self-understanding. Person-centered therapy is talk therapy where the client does most of the talking. Unconditional positive regard is when the therapist accepting who you are. Hypnosis is a state where a person is more focused on their inner experiences and less aware of the surroundings. Post-hypnotic suggestion is instructions given under hypnosis. Psychopharmacology is the study of how drugs affect the mind. Psychoactive medications are drugs that affect thoughts and behavior. Antidepressants are coping with depression symptoms. Anti-anxiety medications are medications that reduce anxiety symptoms. Lithium is a mood stabilizer for bipolar disorder. Antipsychotic medications is when you're treating psychotic symptoms, such as reducing hallucinations and schizophrenia. Tardive dyskinesia is involuntary movements from medications. Psychosurgery is surgery on the brain. Transcranial magnetic stimulation is magnetic pulses to treat depression. Electroconvulsive therapy is electric shock for severe depression. Lobotomy is outdated brain surgery for mental illness. Post-traumatic growth is positive change after trauma. That's it for Unit 5 Part 2, and from now on, all the videos will be about Unit 1 through 4 and I'll make videos on how to do the AAQ and the EBQ.